So my lightning strike this year is on muscle cramps. Muscle cramps are clinically characterized by acute pain, persistent soreness after the cramp has dispersed, could last 2 to 3 days, swelling, and usually they are explosive onset, they're visible, palpable contractions, and are usually present in one muscle group or another, like the gastroc. They are involuntary, painful. They are spazzing contractions of the muscle group, skeletal muscle. Basically, there's two primary categories of exercise-associated muscle cramps. Those related to muscle overload and fatigue, and then those skeletal muscle cramps that are associated with sweat-induced sodium deficient exertional heat cramps. Predisposing factors associated with overload and fatigue relating muscle cramps are older age, poor stretching habits, they haven't been conditioning, they have a history of cramping, and excessive exercise intensity and duration, along with related metabolic disturbances. The predisposing risk factors for the sodium deficient muscle cramps are extensive sweating, and consequent significant whole body exchangeable sodium deficit. So that's a more widespread muscle cramping, even when there is minimal or no muscle overload or fatigue. The sodium deficit causes the muscles to seize. Basically, the gold standard for a muscle cramp in most situations is stretching. The overload and fatigue related muscle cramps are localized and overworked, and so these can often be resolved by passive stretching, massage, and then an active contraction of the antagonist muscle group. So if your gastroc is cramping, have the athlete pull their foot towards them, activating the anterior tib, and usually the muscle cramp will resolve within a couple of minutes. The treatment of acutely cramping athletes, passive stretching is still the go-to, and preventing said muscle cramp from fatigue and overload is stretching beforehand, and not going as hard. Having them go through the range of motion that they're going to be doing most in said athletic event before will also help prevent the exercise-associated muscle cramps that have to do with fatigue and overload. When you get if stretching isn't working and you don't think that this muscle cramp is caused by fatigue or overload, an oral ingestion of high salt solution has been proven effective field strategy in relieving cramping and preventing muscle cramping from developing further into a more severe or debilitating muscle cramping. When an athlete has been determined to be electrolyte deficit, continuation of activity at the same intensity is possible. If it was a muscle overload or fatigue, that wouldn't be possible. So if they can keep going, even though their muscle is cramping, like it goes away a little bit, and then they can keep going at the same intensity, it's more than likely an electrolyte deficit, and that is where it comes in with the high salt content, Gatorades, Gatorlytes, and the like. When you compare the gold standards to old school kind of what you hear about the more traditional athletic trainers doing. It's been said that pickle juice and mustard are gaining popularity among certified athletic trainers and other sports medicine professionals as remedies for exercise-associated muscle cramps. Really, these would only be effective in the electrolyte deficit, if at all. They're not really going to do anything for the muscle overload or fatigued muscle cramps, but a couple studies have said that about 19% of athletic trainers give athletes pickle juice for cramping. Ingesting high sodium drinks pre-exercise can improve thermoregulation and performance. So that's another route you could take with the pickle juice and the mustard. They have high sodium, and they could possibly increase thermoregulation, which would increase like your core heat, and that would help prevent muscle cramping, apparently. And apparently, according to these studies, pickle juice has many positive physiological effects for an exercising person. And it is said that it is possible for them to relieve the electrolyte deficit muscle cramping. I don't know if the pickle juice has enough oomph in it, I would say, to treat the exercise-associated muscle cramps due to electrolyte deficiency. I think Gatorlytes would serve that purpose a little bit quicker, maybe. But there could also be the psychological kind of effect, like, hey, if you get a muscle cramp on the field, I'm going to squirt a packet of mustard into your mouth, or I'm going to make you drink pickle juice. Maybe think about making sure you're well hydrated, you've eaten well today, and you've stretched before you go out to play, and that won't happen to you. So there's also that route you could take when thinking about why these kids are cramping and how to fix it. And yeah, that's all.